Today, what we're going to do is I'm going to follow up on the last video I did that showed you the $2,000 out-of-pocket and the Medicare Prescription Payment Plan as it relates to someone with a standalone prescription drug product. What I want to show you is what the difference in the cost look like if you were to choose a Medicare Advantage prescription drug plan. And so a Medicare Advantage prescription drug plan, or an MAPD product for short, is one that covers everything that original Medicare covers, which is A and B, and then everything that is C, which is supplemental, as well as D is your prescription drug coverage. So that would include your hospital, your doctor's office, your lab, hearing, vision, dental, and your prescription drugs. So all of that would be a part of an MAPD product. When you have just a standalone prescription drug plan, that's a Part D plan only. That's just covering your drugs. And then you may have Parts A and B with that, and maybe a med sup. So I'm going to go ahead and share my screen. Okay, so whenever I've got this pulled up, I already put the drugs in. These are the same drugs that I use in the PDP video, and I've got the same county, Richland County, and then we're shopping for a Medicare Advantage prescription drug plan. So what you see, remember, it comes as the lowest drug and premium cost. So over here we see that lowest drug and premium cost is the default. The first plan that comes up is this United Healthcare plan, and it says it's a $0 premium, and the total drug and premium cost for the rest of 2025 is $677.50. So just know that this total drug and premium cost is going to be for February through December. So what happens is, if you recall from the PDP video, if you enroll into a plan, today is January the 10th, the next effective date is going to be February the 1st. So therefore, this is giving us the cost from a February 1st effective date all the way to December of 2025. So you see it's $677.50. There is no health deductible. The drug deductible is $255. And then these in and out of network costs are for your medical benefits. All right. And so we scroll down. The next one is going to be another United Healthcare plan of $762.50 with a $340 deductible. And then third is Humana Gold with a total cost of $794.67. Now, most of the plans in our area have a $0 premium. However, there is a carrier, Blue Cross, that actually has a premium, which I want to scroll and find for you, just so you can see some of the differences here. So here's no, that's the total value that has $0 for the premium. Let's see. Okay, so this one right here, Blue Cross Total, has a premium of $19. And then it says the total cost out of pocket is going to be $1,758.50. And then here's your maximum out of network and in network for the medical side. And this one has a $0 drug deductible. So you may be saying, well, Renata, this looks pretty cool because it has no drug deductible, but why am I paying so much more out of pocket? So $20 times 11 months is about $220. So $220 of this is going to be premium cost. But the rest of it is going to be how they actually have the plan design built. And so when we go into it, this is going to look very similar to what we saw in the PDP video that I did. And so what happens is, when you scroll down, you see these are the yearly costs that you'll pay, and the total yearly drug cost is $1,549.50. So for this one, you see the preferred brand is a 25% co-insurance. So that is the defined standard for that tier that CMS is set for 2025. So you're having to pay that entire 25% yourself. This particular plan didn't give you any enhanced coverage on that. However, if you recall, it does not have a drug deductible. So let's scroll back up so you can see that. It does not have a drug deductible. So that $590, which is the defined benefit deductible for CMS, you're getting counted credit for that towards your $2,000 without actually having to pay it. So this product here is an enhanced alternative plan, and it's enhanced alternative because it gave you credit for your $590 drug deductible. However, when you go down to look at the actual tier structure, you're going to pay that 25% of tier 3, which is part of that defined standard. So you're basically paying more for your prescription brand drugs on this plan than you would on the United plan. So let's go back and look at the United plan. So when we go here and we go into plan details, and we're not going to go through all the rest of the stuff, we're just doing the drugs. When we go through the drug part of it, you see the total price for the whole year for the Eliquis is $141. Linzess is $395. Ozempic's $141, and the total yearly cost is $677.50. You recall from my other videos that I told you for 2025, the maximum out of pocket is $2,000. Once you, as the Medicare beneficiary, has met that $2,000 out of pocket, you do not have to pay anything else out of your pocket. Okay. And so that doesn't necessarily mean that $2,000 is all what's coming out of your pocket. It could also mean what the plan is paying on your behalf when you're in an enhanced alternative plan, such as this one. So in the Blue Cross plan that we looked at that had the deductible for $590, but you had $0 deductible, that $590 counted towards your $2,000. In this particular example, this plan here, when we scroll back up, the drug deductible is $255. So if we pull out our trusty calculator and we take 590 and we minus 255, so $335 is what you're going to get counted credit towards your $2,000 out of pocket that the plan is paying on your behalf that you don't have to pay for. And then when we scroll down and look at the actual benefits, we see that preferred brand drugs is $47. So instead of paying 25% coinsurance, you're only paying $47. So in this example, we have this Eliquis. The cost for Eliquis is $616.21. So 616.21 times 0.25 is you would have to pay $154 for this medication if you were on a defined standard benefit plan or one that had 25% coinsurance. However, because United in this example is only charging you $47, you're going to get counted credit for the actual difference. Let's see where it is. Yeah, so because the preferred brand for this Eliquis is $47, you're going to get counted credit for $107 that did not come out of your pocket. So that is why your cost under this plan is a whole lot less than it is under the Blue Cross plan. And the cool thing about the plan finder is you can go in here and you can click compare. And then the other one was on page 3. And when we compare these two together, what we see is this one has a deductible of $255. This one has a deductible of $0. The United plan has $0 premium. Blue Cross Total has a $19 premium. Both of them, you're going to have to pay your $185 for your Part B, because remember, you cannot be in a Medicare Advantage plan if you do not also have Part B. And then when we scroll down to the drug part of it, we can see that all four drugs are covered, which is great, but look at the difference in the price. $677.50 over here for United, and $1,758.50 for the drugs, as well as the premium, so you're paying a whole lot more. So that's how you look at this particular plan. Well, let's say, let's go into this plan details for Blue Cross that has the higher amount out of pocket, and let's go and look at what you would actually pay. So in February, if you got all four of those drugs filled, you're going to pay $532.23. March would be the same thing. April will be $485.04. And then from May to December, you don't have to pay anything because you have met the $2,000 out of pocket. And that's because you paid close to $1,500 and some odd dollars out of your pocket, plus the $590 deductible that you're getting counted credit for. So now you're at your $2,000. As you saw in the Part D video, we talked about the Medicare Prescription Payment Plan that allows you, as the Medicare beneficiary, to pay the plan, here in this example, Blue Cross directly, versus having to pay this $532 out of your pocket at the pharmacy. You can spread it out across the plan year. And if you look right here, which I always, here it is. So if you go here and you click it's going to show you how your monthly bill would be. So instead of paying the entire amount February at the pharmacy for $532, you would just get a bill with the Medicare Prescription Payment Plan for $181.82. In March, you would get a bill for $88.26, and then from April all the way to December, you're paying about $142 until you get to your total drug cost of $1,549.50. So this is one way, if you're on a plan such as this one, that you would actually, if you don't want to pay all this up front, you can spread it out across the calendar year. Now, when it comes to a Medicare Advantage prescription drug plan, you may be asking yourself, well, why in the world would somebody choose this plan over the United plan when they can save over $900 or $1,000 a year? Well, you got to remember, this is a Medicare Advantage prescription plan. So there's also medical coverage in here. So the coverage we didn't go over, ambulance coverage, inpatient hospital, outpatient, your lab services, your primary care doctor, specialist, all that stuff's in there. So whenever you're in a Medicare Advantage prescription plan, you're not just looking at drugs alone, you're looking at the total package, because it's going to cover your medical benefits, it's going to cover your prescription benefits, and it's also going to cover some things that original Medicare does not cover, like hearing, vision, dental, going to the gym, over-the-counter, things of that nature. All right. Now, what I want you to also know is that the Medicare Prescription Payment Plan is not just available to people who have high drug costs. That is who it was made for, so that you can spread them out across the year, but it is open to everybody who has a prescription drug plan. And I say that, so this $677.50, when we go into drug coverage, you can actually go in here and do the same thing, and it will tell you how much your drugs cost. So in February, under this United plan, because of that deductible, you're paying $395.50. And then in March, you would pay $141, April would be $141, and then you're finished for the year. However, if you're saying that $395 is a lot to pay in February, then you can opt into M3P, and you will get your first bill for $181.82. And then the next month in March will be $35.47. And then April all the way through December, you're paying about $51 per month in order to make up the $677.50. So I hope that what you can see is that CMS has tried to make it possible for you to have some flexibility in paying for your drugs. This is in no way a cost savings, okay? So you're not saving any money by opting into M3P. Whether you paid it out of your pocket at the pharmacy, you can see here you're going to pay $677.50, or whether you are opted into the M3P or Medicare Prescription Payment Plan, you're still paying $677.50. So by no means is this a cost savings. This is just a flexibility option for you to be able to spread the cost of the drugs out over the calendar year without having to pay so much up front. All right, so that's all I had for this video. What I really hope that you took from it is the differences between someone who's in a PDP product versus somebody who is in an MAPD product. And quite frankly, let's do this while I still got this pulled up. I'm going to share my screen again, and I'm going to show you one other thing so you can see it kind of in real time. So let's go back to plan comparison, go back to plan results. And then once we get here, I don't want to do these comparisons anymore here. I am going to go up here and I'm going to change the plan type to prescription drugs. And so when I do that, remember right here, we got the first plan that comes up as United for $677.50, and we're going to click apply. So this is changing us from looking for a Medicare Advantage plan to a prescription drug plan. And what you see is the cost goes up to $1,443.20, still a United plan, but it is technically going to be the lowest drug and premium cost, including this $89.20 monthly premium. Okay, there's no drug deductible. And so if we pull out our calculator again, 89.20 times 12 is 1,070. And then if you minus the 1,443, it's about $372 of this is drug. The rest of it is premium. And then you have the next plan, and then you have the next one. And so if you go back and look at my PDP video, and then you look at this MAPD video, it'll put the puzzle together for you so that you can see the differences between how these benefits are actually set up, and which one may be the best plan. Now, I am not going to have you actually have to go and do all of the work to say, well, which plan should I choose, Renardo? Which one would you you choose? Which one do you recommend to your clients? Because there's different scenarios. And so what I'm going to do is I'm going to create a series or videos so that you can see how I actually guide some of my clients into which plan is going to be best for them. Because sometimes it's best to get a plan that has a premium, and sometimes it's not best to get a plan with a premium. What I can tell you is 2025 is a learning year. It is a year where a lot of changes have occurred in the world of Medicare. And if you slept on not reviewing your benefits and not sitting down with a trusted agent to actually go over them, you may be spending more out of your pocket than you actually need to. So that is all I have for now. I hope you enjoyed this video. And until the next one, please stay tuned and use your benefits wisely.